And we're live.
Hello, everyone. It is Tuesday at 10 a.m., so you know what time it is. The TMI, the Melanin Initiative. Way to open it, right? Well, this month is June. It's Men's Health Month, and we're celebrating all month long. We are very excited about this two-part series and honored to bring it to you as three daughters. You could consider this month dedicated to the girl dads. Be sure to follow us on Instagram, where we'll be sharing content on all things related to men's health, including screenings, specialists, and resources. We even shared pictures of us with our dads and talked about a sweet memory with them. Fun facts about our dads. I'll go first. My dad was a Marine for 30 years and he is happily retired at home with my mother. What about you, Kimberly?
So my dad also retired from the Marine Corps. You know what they say? Once you're in the Marine Corps, you never leave. Fun fact about my dad would be that so actually I have a sibling. I have a younger brother, and when he was born prematurely, so those first several months that he was alive, it was really just me and my dad, and we would eat candy and deviled eggs, as I'm told. What
And
about you, Geraldine?
my dad, he is also retired. He used to work for the company Publix supermarkets. It's a supermarket that's you typically find in like South in Florida or like southern regions. And he's actually been retired for quite some time now. He is fun fact about him, he's actually 80 years old. Everybody's always surprised when I tell them that my dad is 80, but he is in great shape. He walks a lot, so he you wouldn't even think that he's 80. Everyone's always surprised about that.
Wow.
Wow.
Yeah.
Well, I love those fun facts, ladies, but we're going to get back to the show. So, for our viewers, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. So, first, I want to start us off with some statistics. So, per the CDC, 13% of men aged 18 and over are in fair or poor health. About 40.5% of men aged 20 and over have obesity. And that's compared to about 55.9% of women. 51.9% of men aged 20 and over have high blood pressure. And that's measured high blood pressure and or if you're taking anti-high blood pressure medication. So let's look at these statistics one at a time and break down what they actually mean. So when I say 13% of men age 18 and over are in fair or poor health, that means you have at least one condition that requires medication management. That number could be your weight, could be blood pressure, risk for diabetes, level of anxiety or depression, or even quality of sleep. These are all measurable numbers or data points used to make a diagnosis and evaluate how well your disease is being treated. It's not unusual for a man to get admitted to the hospital in his 40s, 50s, or even 60s for the first time and get diagnosed with something like high blood pressure. The only reason they've never been diagnosed is because they didn't see a healthcare provider. It's very unlikely that one would experience a heart attack, stroke, or kidney failure without having untreated high blood pressure, and for that to have been present for a long time. So we're here to tell you that go to see your primary care provider. One thing you're going to take away from the TMI initiative is that we're going to tell you got to go see your primary care provider.
Preventative care is the best care.
Absolutely. So when I gave the statistic of 40.5% of men age 20 and over have obesity, and that was compared to 55.9% of women. So not as bad as the women, but still close to half of men, right? So obese does not equal you appearing to be fat in the medical community. Your weight increases your risk for heart disease, diabetes, back pain, and joint problems. We often see in Black and Brown communities the weight on the scale is not taken as seriously, and we often lack the understanding of what contributes to that number and the consequences of it, especially once we hit age 40. But now we're also seeing these same complications in children because of the standard American diet and lifestyle. And we all know we love a good meal on Thanksgiving, and then we enjoy that meal for a week. And
Yes.
then we go to a party the Saturday after and we eat a cheat meal again. And eventually those cheat meals add up, friends. So, while monitoring your weight is important, it is more important to maintain an active lifestyle and consume more fruits and vegetables and less processed foods. Notice, we did say you had to we didn't say you had to eliminate anything. We're putting emphasis on what to add to your plate and where your attention should be placed. People often get very defensive over their food, which is often tied to culture and tradition and memories of loved ones who may or may not be with us anymore. And sometimes it's financial. And I know, and we're all sensitive to that. We really just want to emphasize abdominal weight because it has a greater impact on your risk for high blood pressure, heart disease, and other chronic diseases. Sorry, lost my thought there. The next statistic I gave was that 51.9% of men aged 20 and over often have high blood pressure, and that's compared to 57.6% of men. So, regardless of your gender, men or women, over half have a diagnosis of high blood pressure, which, as a reminder, is measured by high blood pressure, the value, and or if you're taking any anti or non to get rid of your high blood pressure medications. So that means about 1 in 2, either you or the man sitting next to you has high blood pressure. And that's a serious problem, friends. We're talking about it. And it's completely in our hands because there are so many things we can do to prevent getting that diagnosis and to reduce our need for medication after we've been diagnosed. You'll hear us say often, a diagnosis does not have to be a destination. Can I get an amen?
Amen.
Amen.
But you do have to make changes, and often those changes are lifelong. But so is medication and the anxiety and depression that accompanies the chronic disease. In most recent years, the leading causes of death in men have changed. It's now heart disease, cancer, and COVID-19. For Black and Hispanic men in America, cardiovascular, which breaking down that word, it impacts your heart and blood vessels, disease is the number one cause of death. Cancer is the leading cause of death in Asian men, but cardiovascular disease is only a 1% difference. So, what do I actually want you to take away from this episode? Your TMI takeaways for today are: what is cardiovascular disease and what are the causes? Why is it plaguing our community? And what can Black men and men of color do to prevent cardiovascular disease? So, Geraldine, give us some more fun facts.
All right. So Alicia brought up, definitely has been talking a lot about cardiovascular disease, and you typically hear it as well as like heart disease. It's also known as heart disease. So many different diagnoses could be considered heart disease, and these diagnoses include heart attacks, strokes, heart failure, and arrhythmias, which is basically like weird heart rhythms or abnormal heart rhythms. And blood pressure tends to be a factor that affects or that can cause a lot of these issues. So you will tend to hear us talk a lot about high blood pressure because it affects so much as far as our health is concerned. There are several tests and procedures that are performed to determine the extent of heart disease and heart damage, depending on the disease process that your doctor is trying to figure out, or the disease process that they're concerned about. The treatment and the length of treatment will be determined by your doctor. It also depends on what it is that we're actually treating. There are several risk factors for heart disease that are not within your control, and these are called non-modifiable risk factors. So things such as your age, your gender, your family history, like genetics, or your socioeconomic status. These are things that are kind of like out of your control. But then on the other hand, there are risk factors that are in your control. These are called the modifiable risk factors. So this includes things such as smoking, drinking. So if you're a smoker or a drinker, you can quit smoking, you can cut back on alcohol. These are things that you can control. If you are your diet, if you're eating high fat and high salt diets, these are things that you can change. And also like exercising, those are all things that you can do to kind of help decrease your risk for developing heart disease.
Before you move on, Geraldine,
Mhm.
curious that socioeconomic status being non-modifiable. So, as just as a side note, everyone, we work on this show together, but sometimes we work on it independently. So we learn along with you. And today I'm learning that socioeconomic status is considered non-modifiable. Now, are we saying this is happening as like in childhood?
Um,
Because at some point it is within your control.
I didn't write that.
Well, your socioeconomic status or like how you're brought up in childhood, yes, isn't it?
Yeah.
You don't determine that. So that's out of your control. Yeah.
Okay.
So how you're brought up is out of your control.
Okay, great.
Okay.
So yeah, that could technically go in both categories.
Yeah. And since this is Men's Health Month, and also people, sometimes are victims of their circumstance. And even though it can be considered modifiable, some people can't get out of poverty situations. It's not like it's their fault. And it's just they're the products of their environment. They might not have healthy options in their neighborhoods. They might not have walkable areas to get exercise, or safety is another thing as well. Depending on where they live, they might not be able to safely go out and get the exercise that they need to kind of help decrease their risk for heart disease. But going into a different topic, since this is Men's Health Month, we want to take the time to talk about testosterone and its relationship to heart disease, which we will be going more in depth in one of our future episodes. Also, we will be talking about the LGBTQIA plus community, as June is also Pride Month. So we want to talk about testosterone replacement therapy and gender affirming treatment using testosterone, and the implications for you and your healthcare provider in identifying your risk for cardiovascular disease. For today, though, what we will say is that for people who identify as male, it's important to disclose your preferred pronouns if you have undergone any gender affirming surgeries or take any gender affirming treatments. In both cases, the body is altered to make the person look the way they feel internally, which is known as gender identity, and it's not based on the gender assigned to them at birth. These changes to the body may decrease or increase their risk for heart disease and certain cancers, to name two examples. As clinicians, it's important for us to create a reputation in the community to let patients know that they are welcome in our spaces, in our practices. And it's also important for us to obtain training or ask like our places of employment for continuing education as it relates to being like culturally competent and inclusive, to include people that are coming into our practices, especially those that are including like the secretaries, who are often the first point of contact when a patient comes into a practice. So it's very important that as clinicians and as medical practices, that we provide culturally competent care and inclusive care for everyone.
It's
Beautifully
great.
said, Geraldine.
Yes. I was gonna say it's great that you mentioned that. And actually, in the District of Columbia, my two colleagues here are nurse practitioners, so I'm not really sure what they have to do for continuing education, but for just standard registered nurse, like continuing education credits, the District of Columbia actually requires us to get education in LGBTQI plus as part of our hours. Like there's a specific amount of hours we have to get towards that. So I'm actually very proud to work for the district and making sure that everyone who works in the district who has a license is obtaining the continuing education.
Actually, we're all licensed in DC, so we all have those
Yeah.
same requirements. Yeah, and so
Yeah.
we do two things with this show. We educate the community, but we also, in terms of health literacy, but also to promote nursing.
Mhm.
And so, Alicia brought up a great point, right? Because even if we're in the same profession, we don't always know what the next level requires, what the requirements are. So because we still have to maintain that RN license, that registered nurse license, our requirements are still the same.
Mhm.
You just might see additional like pharmacology or different
Yeah.
hours, but whatever you have to do, we have to do that and some more.
Well, wonderful. See, we all learn on the Melanin Initiative.
Yeah. Where were we?
Social determinants of
Yeah, I
health.
think you were going to give us some more fun facts, Kimberly.
This is a heavy show, right? We have a lot of facts. So certainly feel free to come back and rewatch it again. And what I would like to say is, like, each week we're going to do a little bit of education. You come back the next week and we just build on those layers, because it is a lot to learn. But here at the Melanin Initiative, we avoid TMI, right? We avoid too much information at once. So social determinants of health, basically these ladies have actually already brought it up. We just didn't give it a name. So social determinants of health have a major impact on people's health, well-being, and quality of life. Some examples of social determinants of health include safe housing and transportation, as well as the neighborhoods that we live in. When it comes to meeting our daily needs, our first priority goes to safety, making a living for our family, and having a sense of belonging. So maybe some of you are familiar with Maslow's hierarchy of needs. So for instance, if you come to me and you have high blood pressure, and I'm telling you it's really important that you work out, that you eat healthy, and that you take this medication. For me, that's a top priority. But for you, if you have a house that you don't feel safe in, or a place that you cannot rest your head, that is going to be your first priority. And everything else after that is going to be secondary. And depending on how long it takes for you to secure a safe place will only further prolong your ability to pay attention to your health.
Mhm.
Until those, oh, so I just said that actually. And so until those needs are met, people and men in particular are even more prone to hold on, wait. Until those needs are met, people and men in particular are even more so those in, oh, okay. I'll be editing this.
Take 3.
Although
Yeah.
I did get feedback that when we have these bloopers, that they enjoyed that part. It
Now we're
humanized
just
the show.
Yes.
So until those needs are met, people and men in particular are even more, and even the men in older generations have been socialized to believe that their identity is based on being a provider. That weighs on men physically and psychologically, and it influences how they spend their time, their money, and whether they have the energy to actually work out. Stress increases our cortisol hormone, and that influences cravings for things like salt, sugar, and fat. So when you get off work and you've had a stressful day or a stressful week, that's why you're more inclined to reach for that hamburger and fries, those cookies,
me.
cake. And that's why, we say it's such a hard thing, right? To
Mhm.
make these lifestyle changes, because we have internal signals that are affecting our external decisions. And when we look at the roles that we live in America, there are some external pressures that can make those decisions much harder. Okay. We're not making excuses for people. We're really just trying to explain the whole picture so we can have an understanding of like where we're starting from and then how we can move forward. So another social determinant of health is racism, discrimination, and violence. We know racism in America is systemic, and it plagues everything from education to employment, access to funding, policies, our political system, who represents our most pressing concerns, what colors our lived experiences, and has had a direct impact on our lifespan, among other things. It has severely harmed men's trust in leaders, and that includes healthcare, knowing who and what to trust. Education, job opportunities, and income are another social determinant of health. And while I'm talking about this, make sure you go over to our Instagram. We'll provide a visual representation of this because I think it's really easy to understand when you see a picture of it. So when it comes to education, we know children of color are not always given the attention they need to excel. Their learning style is often misunderstood and misdiagnosed as ADHD, leading them to be isolated and or medicated, which directly impacts their quality of education, their confidence, and determines the careers they pursue and how those in those hiring positions assess their qualifications. It's often been said that the education system in America is a pipeline to prison, and that is supported by the numbers. Once our men are part of that system, they end up fighting to prove themselves, whether they were rightly or wrongly charged and convicted. It breaks up families, which have been shown to be correlated with health outcomes. Access to nutrition, foods, and physical activity also can impact health. We know it's cheaper to buy 2 hamburgers and a large fry than it is a smoothie or a salad. Communities of color often live in what's known as food deserts, which means that there's more convenience stores with processed foods and liquor stores than there are places like your natural food stores, farmers markets, and fresh produce, or even just quality produce at an affordable price. When kids grow up on those types of foods, it increases their risk for heart disease or high blood pressure, impairs their taste buds, and forces them to have to undo bad habits before they can even develop good ones. Polluted air and water. So, communities of color are often the desirable places for landfills and toxic waste, which increase our risk for things like asthma and limit our access to green spaces, which are correlated with lower rates of asthma in communities. Whenever you see these green spaces, you're likely to see lower rates of and lower rates of asthma. Language and literacy. So this goes back to education and the quality that education, whether kids and adults are given access to opportunity to learn about things that interest them, to have someone evaluate their reading, writing, and communication skills. Many people in communities of color are judged by the tone and inflection of their speech, which may have a direct reflection of the communities they grew up in, but not a reflection of their level of education or potential. We're still hearing comments about how well we articulate because the stereotype is still prevalent. It can be tough because language is cultural. You may have to talk one way at home or in the neighborhood to belong, and another way at work to excel.
Sorry, just a little
Geraldine,
disclaimer. Just a little
huh?
disclaimer, guys. I am a little sick, so but the show must go on. So I apologize in advance if you see me coughing. But those are great points that you brought up, Kimberly. The good news is that there's a lot happening within our community and with our allies that's having a positive influence on what everything that Kimberly just mentioned. There are Black and Brown owned businesses that are building affordable housing, establishing reliable transportation or access to ride shares, bikes, and scooters. Entrepreneurs are opening up juice shops, grocery stores, and creating food delivery companies. There's just a plethora of current and former teachers and mentors creating LLCs to improve access to education and create a community support. We're seeing greater representation in our political system from people who look like us, where people of color are writing books, entering the legal system, and creating content to tell our stories. All these initiatives are excellent, and it's just a few examples of what's being done, but they need our support. We have power in numbers, and once we recognize that, there's no limit. Just keep in mind that there's always going to be resistance to change, but don't let that discourage you. In healthcare, now when we look at what we can do to make it better as clinicians, we think the first place to start when it comes to improving health outcomes and access to care for men of color is to improve communication and create a safe space so that they feel heard and respected. With the exception of younger generations, men have not always been socialized or encouraged to talk about their feelings. They may or may not have had role models of good health, and they may not have had access to health education. What we know from talking to a lot of older men who fit that description is that the primary reason they have poor health is because not enough people took the time to talk to them, to check, to make sure that they understand, what's going on, to show that they care or to explain why they should. It's certainly not the life they would wish for their children. In other words, we can't let the world our parents grew up in limit or dictate the world we live in. Things have changed, and we have access to knowledge 24 hours a day. With this age of technology, there's so much information out there, and a lot of us also have health
sometimes it's
insurance.
too much information.
Say that again.
Sorry. Sometimes it's
Oh,
too much information. I
yeah,
couldn't let it get by.
right.
My.
True. We also have a lot of us have health insurance, mental health benefits, and there are even those that don't have health insurance. There are a lot of free and reduced cost options that are out there for people, so that there's really like no excuse for us to not seek medical attention or seek these services.
Thank you, Geraldine and Kimberly. So I know we have kept you over your 20-minute limit here, but we shared a lot of important information to you. And as Kimberly stated earlier, please feel free to go back and rewatch. We have these on all social media platforms for you to enjoy over and over again and to share with your friends. So, to recap, our TMI takeaways for today include what is meant by the term heart disease, what are the causes of heart disease, what factors have contributed to heart disease that are plaguing our community, what men of color can do to prevent heart disease and lower the risk of getting it, and most importantly, We want to encourage you that receiving a diagnosis does not have to be your destination. I'm going to say that again. Receiving a diagnosis does not have to be your destination. And even if a disease runs in your family, okay? With the support of a healthcare professional and shared decision making, the two of you and your family can come up with a plan that helps you reach your therapeutic goals, like consistently having a high blood pressure less than 120/80 or an A1C less than 6%. So you can safely come up with a plan that may include decreasing the dose of a medication or even stopping it once those goals have been met. And your healthcare provider reports that your risks are low enough. We do not recommend stopping medications on your own without medical supervision. There are consequences associated with stopping medications abruptly and without having a plan in place that we want you to avoid. Safety always comes first. So once again, we apologize for going over our 20 minutes, but we had a lot to cover. And if you missed anything or need to hear it again, certainly rewatch the episode and check the description box for show notes. It's Men's Health Month, and according to the latest evidence, heart disease is impairing quality of life and killing our men at faster rates than any other condition. It would be irresponsible of us not to address it. However, because it's Men's Month, we also want to make sure we talk about what concerns men most. We polled the audience, and we heard that men want to hear more about testosterone, urology, weight management, and cholesterol. So we've decided to have a Men's Health Part 2, which will premiere later in June. We could also address those topics and tie them together. In the meantime, all month long, you can visit our Instagram page and find helpful information on those topics pertaining to men's health, including when you have to have a prostate exam, how often should you get a colonoscopy, hair loss, gender affirming treatments, and cosmetic procedures. Continue to send in your questions and we'll address them via social media and in future episodes. When we reach 100 subscribers on YouTube, we'll go live and answer your most pressing questions in real time. That's a challenge, friends. Remember to like, follow, and share, especially with your parents, aunties, uncles, cousins, neighbors, co-workers, and those church members, okay? In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking down things into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking up too much of your time. Thanks for tuning in and join us every week at 10 a.m. TMI Tuesdays. Ta-ta.
Bye.
Thank you for watching.